Eating disorders are characterized by irregular, unhealthy eating patterns. These eating patterns most often involve overeating, undereating, and binge eating, as well as overexercising.
Abnormal behaviors aren't just the strange quirks we all have. For behavior to be considered abnormal, it must be statistically infrequent, cause distress to both oneself and others, and impair day-to-day functioning.
Eating disorders thrive because they are all based around control. Someone with an eating disorder may experience control issues, feelings of guilt, be highly competitive, and have overly obsessive or controlling thoughts towards food and their own bodies. Avoidance of food altogether, purging and binging, overexercising, and obsession over weight are all common symptoms of eating disorders. Simply being a picky eater is not necessarily an eating disorder. Being a picky eater is a fairly common thing, but this in and of itself does not mean you have an eating disorder.
Some examples include anorexia nervosa, bulimia nervosa, binge eating disorder, and anorexia athletica.
Many people hear about the symptoms of psychological disorders and fear that they may have one. Nobody can diagnose you with a psychological disorder except a trained professional, such as a psychiatrist. If you believe you may be suffering from this type of psychological disorder, please seek help from a trained professional.